With one MRI shows multiple large areas of well-described predominantly homogeneous dose T2s and low intermediate T1 signal within the biometric number of peritoneal nodules diagnosed uterine neomyomas. Inside the well-circumscribed low T2 and low to intermediate T1 signal within the biometric and multiple peritoneal nodules shows uterine neomyomas or fibroids. With a 2-day-old neonate ultrasound enlarged right kidney containing multiple non-communicating cysts of varying size with little non-parenchyma, most likely abnormality of the contralateral kidney is respiratory reflux. The diagnostic is multicystic dysplastic kidney. With 53, grade 4 renal injury, deep lesion into the collecting system. Grade 1 is contusion, grade 2 is less than 1 cm, grade 3 is greater than 1 cm without collecting system environment, grade 4 is lateral into the collecting system and arterial system, and grade 5 is shattered kidney. Reverse small solid enhanced lesion and CT at the lower part of the right kidney. 9 mm inside most appropriate management, repeatedly in 3 to 6 months because it is less than 1 cm. Renal tract tuberculosis, which period is atypical for renal tuberculosis, bladder calcification. The tuberculosis shows scar and reduced bladder capacity. So bladder calcification is not seen in tuberculosis. 56. Primary peritoneal oligomenorrhea. Hirsutism, BMI of 31, which MRI findings are diagnosis. Multiple small peripheral round eye T2 signal areas with hypotensive central trauma in both ovaries. This is polycystic ovarian syndrome. 27. 12-month-old infant with aniridia and nephroblastoma. CG shows bilateral enlarged kidneys with a thick ring of homogeneous non-enhancing hypertension bilaterally. The enhancing mass with cystic chain is noted on one side. Diagnosis is premature. Bilateral enlarged kidney is thick rent of homogeneous so this rent is seen in premature. Urinary mountain biker suspected of sustained urinary injury, resident to the right kidney on CT, contrast enhancement during the graphic phase. Examination. What is the significance of this finding? Urinary leak. Contrast enhancement during during pyrographic phase shows urinary leak. 29 sits as 2F requiring follow-up. According to Bosnia classification, which period is seen? Multiple thin non-enhancing septa. 60 kb, X-ray is normal, CD kb, no calculus but mildly dilated left renal system as far as the midmeter with periodic stranding to this point. MRI shows urogram filling defect in the left ureter. Diagnosis of obstructed ureteric calculus is made. Patient passes a calculus, which clinical history is relevant at policy patient on antiretroviral therapy. He is one of 43-year-old woman with history of breast carcinoma and CT of the abdomen for abdominal pain and menorrhagia. This reveals an enlarged uterus and T-positive MRI. The normal T2 zone enlargement of the uterus is preserved. The endometrial stripe is high T2 signal and measure 14 mm in diameter, so 14 mm endometrial stripe is large. And the patient history of breast carcinoma, so this 14 mm is seen in tamoxifen therapy, most likely. Later is like enhancement of the high signal on T2 WM endometrial area demonstrated on T1 post contrast indication. No evidence of myometric invasion. Diagnosis is tamoxifen therapy. 62 or 3 cm renal cell carcinoma undergoes cryoablation with suggestion of complete treatment or recurrence. Appearing to unchanged in size over time shows in recurrence. 63 RTA rotator external with the gram shows contrast excavation below the urinary diaphragm only. What type of injury is it? Anterior urethral injury. 64 4 cm left renal mass. What will be most helpful when determining abscess of teeth diagnosis like carcinoma invading the cortex rather than a renal carcinoma invading the collecting system? Maintenance of renal shape in transcendental carcinoma. 55. A 38-year-old patient referred for an entered IVU and ultrasound by a GP. The picture of mild renal impairment on renal blood test. So then the ultrasound shows 2 normal sized kidneys with no evidence of cortical loss. IV juice shows normal enhanced renal ordinary, but the pelvic system is abnormal. Some cases show split club shape, which shows renal papillary necrosis. And this is Q2, called Q2 chronic and shared cylindrical overuse. From this given option, which is most typical history, chronic and shared gastric overuse. The 6 of the 7-year-old woman presented an watery binary discharge and transport of MRI pelvis. She was quite claustrophobic at the end of the scan, and you are called to assess her as she has been hyperventilating and regravity has become concerned. Be sure you notice some perioral pigmentation. MRI shows multicystic lesion. The third cervix with a solid dominant deep trauma. You note from the picture that the brain edema previously revealed severe chronic bleed. Most likely cause MRI finding is minimal inflammation and endocarcinoma of the cervix. 67. The patient had a gynecological cancer that was treated at RC the unilateral thickened interlobal septa, perilambic nodules, and biliary cervical iron lymphadenopathy diagnosed cervical carcinoma. Because the patient had treated gynecological cancer with radiation therapy and now he's getting lymphatic carcinomatosis, so diagnosed will be cervical carcinoma treated. 68 HSG multiple small outpouring from the uterine cavity diagnosed is adenomyosis. Because salpingitis erythema nodosa will show multiple outpouring from the fallopian tube. 69 divergent uterine horns with a deep midline funnel cleft, two separate uterine cavity, two separate cervices, and a unilateral hemivaginal septum causing endometriocolpus, primary uterine anomaly, uterine diladelphys because there are two uterine cavities, two cervix, and associated with vaginal septum in 75% of cases. 70 suspected bladder injury, series with molar tooth appearance. What is the significance? Extra point 1, bladder rupture, molar tooth appearance. 71 chicken mandate cystectomy, which would suggest a diagnosis of parathyroid adenoma. Focus of increased retinoid activity within the lower pole of the right lobe of the thyroid on delayed images only. Increased retinoid activity in lower pole of the right lobe of the thyroid on delayed images only. 250-year-old man is discovered to have cystic abnormality in the lower pole of the left kidney during ultrasound scan performed by upper quadrant pain. We think this might be a complex cystic lesion and therefore recommend CT scan of the renal tract. This shows the combination of variable sized cyst at the lower pole of the left kidney but no capsular irregularities of the cyst. What is most likely diagnosed? Localized cystic renal disease. With conglomeration of variable cysts at the lower pole of the left kidney, so localized cystic disease. 73, a 32-year-old patient with a history of renal transplant comes to you and the initial ultrasound shows mild renal pelvic dilatation. Capacity index was 2HU and resistive index was 0.9. Patient was unrelated. Now on day 4, you see that the reversal